Good morning. This is Dr. Timothy Scott back here at LifePoint Medical. It is March the 31st of 2025, and I want to tell you, first of all, I appreciate you listening to me. We're going to be open this morning, ready to go. Call us if you need us. Remember, I want to get to you soon if you're having any medical problems. But today, I just want to go back and talk about a test that we order here quite often. And this test is what gets me up every morning and makes me want to come to work, because I think this test is really serving me and the population well. And I've been doing a lot of research on it. It's that coronary calcium score. I know I've talked about this on here before, but the coronary calcium score is a rapid CT scan that we get done of your heart. And we get a number back from 0 to 10,000 that tells us how much calcification you have around your heart. But it also tells us if any of that calcification is around those critical vessels that are around your heart. So, which is extremely valuable for me as a clinician, okay, because, why do we care about your blood pressure? We care about your blood pressure mainly because of vascular disease, and particularly vascular disease around the heart. Same thing with your sugar, same thing with all of the cholesterol. All of that has to do with trying to foresee or prevent atherosclerosis around your heart, which can rupture, the plaques can rupture, and they can cause a heart attack. So we've got this test that directly measures it. Now, it's not completely linear on how it interprets it, so you do need a clinician to help you with it. But I've been talking to the cardiologist, and I've had some great feedback about what this is doing for my patient, specifically my patient population. I am trying to do it. So let me go back and say this. A coronary calcium score is a test that we do. Insurance does not pay for. It is $99. We can order it. And in talking to the cardiologist, he said it's reasonable to do one of these on anybody over the age of 40. Let's say between the ages of 40 and 80, male or female. You can do this test to see. Particularly if you have heart disease in your family, we want to order this test and look at your heart. If you don't know your family history because you were adopted or something like that, this is a test where we can look and see whether or not you have heart disease or not. If you have really high cholesterol or problems with your blood pressure, or you have diabetes, let's go ahead and look at your heart so we can get ahead of this. Because I think, and I'm pretty sure on this, if you know about a disease and a disease state in your body, that's your best chance of mediating that disease and preventing it from killing you. And this is the number one killer in the United States, is heart disease. So why would we not directly attack the very thing that is the number one killer in America? Now, it doesn't mean we forget about all the other stuff. It's just, why wouldn't we aim for the highest yield? So anyway, if you're interested in this test, I want you to talk to us when you come to your office visit, okay, about this test. But I also want to ask you to do this, okay? I want this done to a lot of people, and a lot of people are not my patients, but I know that if I get a bunch of people to do this test, I'm going to save some lives, and you can be a part of that too. So if you have a family member, or you know somebody where you're worried about whether or not they have heart disease or not, and this test is $99, get them to come here and let's see them and let's order that test if they're a patient here, or get them to go to their primary care doctor and talk to their primary care doctor about them ordering the test. They do them down in Habersham County. They do them up in Franklin. We've got one on each side of us where we can get them done and get them done quick. We can help you interpret them if you don't have a place to go for that. Now, they do demand an order to get these done. Like, it's against the law for them to do them without a physician's order. But if there's a question, you can always send them our way. We'll evaluate them and then send them with an order that way. If you want it, I don't care. This is just a great test. I think it's extremely productive and protective of people when it comes to knowledge and learning about your body. And it's directly related to heart disease, which is the number one killer in America. So if you're worried about it, send them our way. If you're worried about a family member that lives somewhere else, send them to their doctor and say, I want one of these tests. If everything else fails, you can always send them here and we'll get them in and we'll order the test for them. It's $99. Insurance doesn't pay for it, and I'm actually glad of that, okay, because it makes it more affordable without insurance being involved for everybody. And you can pay $99 and it gives you a wealth of information. So thank you so much for listening to me. Call us if you need an appointment at 706-782-0016, and we'll be here to catch your call and get you in to be seen if you need to. Thank you for listening.